Hi, everyone. I'm Caroline Zakarian, and I work for the Office of Civics and Community Services here at the Los Angeles Public Library. Welcome to Black Maternal Health Week. Today's program is called Centering Black Mamas, Families, and Systems of Care. The CinnaMoms, LA County AIM, and the Mashariki Kudumu from the March of Dimes will be discussing how doulas and lactation educators can support Black families and improve Black birth outcomes. We will have a brief Q&A after the discussion, so please send us your questions throughout the program. Thank you, and take it away, Mashariki.
Thank you so much, Caroline. My name is Mashariki Kudumu. I'm the March of Dimes Maternal and Infant Health Director for Greater Los Angeles, and I'm so happy to be here today. And I'm grateful for our partnership with the LA County Library during Black Maternal Health Week. I'm also grateful for our partnership with the organizations featured on this panel, as well as support for Cedars-Sinai to enable us to have these programs. This partnership is critical because the US is one of the most dangerous places to have a baby in the world. What we've seen is that there are greater racial disparities, and these racial disparities continue to persist. While the preterm birth rate has lowered in the US and in California for the first time in 6 years, we did not see this decrease in LA County or Orange County. We also didn't see a decrease in the Black preterm birth rate. In fact, the racial gap between Black moms and other moms is increasing. What we see in LA County is that Black babies are 2 to 3 times more likely to die before their first birthday than other babies. Black mothers are 4 times more likely to die from pregnancy-related complications than their counterparts. And we see these disparities for Black women despite their educational level or income. Chronic inequities, racism, stress, and unequal access to quality care are the root causes of these racial gaps in birth outcomes. So Black Maternal Health Week was founded in 2017 by Black Mamas Matter Alliance. It's a week of advocacy and education. And during this week, we seek to center the voices and experiences of Black mamas and their families to amplify community-driven solutions and enhance organizing on Black maternal health issues. And research has shown that doula care and lactation support improve Black birth outcomes. It increases patient satisfaction and reduces medical costs. However, everyone doesn't know about these resources or has access to them. And we want to change that in today's program. And so we have an incredible panel of experts today to join us. So first, and also I just want to really encourage the audience to participate, put your impressions in the chat. If you have questions, you can put them in the chat, and we will have a Q&A at the end as we discuss. So I want to introduce our great panel today. We have 3. The first is Mercedes Johnson. Mercedes Johnson is a mother of 3. She's a full spectrum doula, a lactation educator, and a community advocate. She's always honored to share the secret, space, knowledge, and wisdom by educating, supporting, empowering, and informing families of their choices. Her love for Black maternal health came after birthing her own children, and like many, her experiences weren't the best and could have been better. And her priority has been to partner with the community to assist with lowering the Black maternal disparities that we see in the Black maternal and infant mortality rates in LA County, with Antelope Valley being her focus. And her goals are to become an internationally board certified lactation consultant and midwife. Next, we have Helene Mitchell, who's a project coordinator for CinnaMoms. She received her Bachelor's of Science in Applied Nutrition from Cal Poly San Luis Obispo. And since then, she has been a PHFE WIC nutritionist and is receiving her credentials as a registered dietitian nutritionist. She is passionate about using nutrition as a preventative method to offset chronic disease, health equity, and promoting breastfeeding among the Black community. And finally, we have Runitra Stewart, who's a registered dietitian and an internationally board certified lactation consultant with PHFE WIC in Los Angeles. She's also a peer counselor, supervisor, and a CinnaMoms support facilitator, and has worked with PHFE WIC for the last 12 years. So first, I want to start with Mercedes. Mercedes, the public is learning more and more about the benefits of doula care. Can you tell us what is a doula and how does a doula differ from a midwife?
Alrighty, hello everyone. So doulas are non-medical providers. We provide emotional support, physical comfort, education, and advocacy, and we promote women and the birthing persons to provide them the tools to advocate for themselves during pregnancy, childbirth, and the newborn period. Doulas can support and help reduce medical interventions. That includes, cesareans, mood and satisfactions with their birthing experiences, and increase the breastfeeding rates. The difference between a midwife and a doula. So the midwife is the actual medical provider, and midwives can support home births, hospital births, and birthing center births.
And can a doula
waist down.
And can the doula do the same thing? Can a doula support in home, hospital, birth centers?
Yes. So doulas can support the families in birthing centers, hospitals, and home births, but we cannot be there just by ourselves. It has to be a medical professional there, to do like vaginal exams, blood pressure checks, and things of that nature.
Thank you. Mm-hmm. And so I want to turn this over to Ronitra. So we hear often about the disparities in breastfeeding rates among Black families. That Black families do not, they have lower breastfeeding rates than their counterparts. But what I'm seeing a lot is more and more support for Black families breastfeeding, and wanting to get from you, why is breastfeeding important? What are the health benefits? And why is it especially important for our Black families?
All right. Thank you so much for having me. Why is breastfeeding important? Oh my gosh, let me count the ways. Breastfeeding is so important because it provides optimal nutrition for the best health, growth, and development of a child. Breast milk contains the ideal balance of nutrients and other factors which protect against disease. And breast milk is dynamic in that it changes and adapts to the individual needs of a baby from feed to feed and even within a feed. Breast milk is breast milk is all a baby needs for the first 6 months of life. It's always clean, it's at the safe and right temperature. And benefits, like you mentioned, for breastfeeding for babies is that it provides the baby with its first vaccination to help get that immune system going. It protects against diarrhea, respiratory infections, ear infections, and it helps with the proper development of dentition or the baby's teeth. And research has indicated that breastfed babies have higher IQs and have a greater protection from obesity and the development of type 2 diabetes later in life. Some benefits for mom. There's benefits for breastfeeding for mom and baby. So for mothers that breastfeed, they can have a faster recovery from labor and delivery. It also helps with postpartum weight loss and the reduction of reproductive types of cancer like breast cancer and uterine cancer. And then it also lowers mom's risk for developing type 2 diabetes as well. And it also helps with the lowering or the risk of postpartum depression. All pediatricians recommend for babies to be breastfed for at least the first 12 months of life or longer if desired. And the World Health Organization and UNICEF actually recommends breastfeeding for up to 2 years. And then there's also benefits to the environment when you breastfeed. There's no packaging, there's no bottles, nipples, there's no waste. And then just the bonding aspect with breastfeeding is priceless. You can't put a price tag on it. And then breastfeeding, in terms of the lower rates in the African-American community, I really feel that it's important for us to get back to normalizing breastfeeding, to have a generational transfer of health and well-being, because as we all know, health truly is wealth. And with our percentages of infant mortality and maternal mortality, breastfeeding is definitely life-saving. And it's also, like I mentioned, associated with lower infant mortality. And it's just the best thing for mom and for baby. So that's why breastfeeding is important.
And Helene, can you tell us a bit about CinnaMoms? Like, why the CinnaMoms? How did it begin? What are some of the programs and services? And why is it necessary to have a program that is solely support? Their sole goal is to really support Black families in breastfeeding and lactation.
Thank you for having me. So CinnaMoms was created in March 2015 by Dr. Tonsay Jackson and Carla Washington, two PHFE WIC employees. And at the time, they created CinnaMoms to combat the low breastfeeding rates within the WIC agency at PHFE among our Black participants. So CinnaMoms was created to add that extra layer of breastfeeding support to increase rates and support for our families. Along the way, they noticed that there's so many other things that need to be addressed to increase the effort of breastfeeding initiation amongst our families. That comes with self-care, mitigating the stress of becoming a mom, talking about becoming a mother, finding that support for the whole family, involving dad, involving partners, and learning how to take care of yourself postpartum, looking for those risk factors associated with our high morbidity rates related to pregnancy outcomes like preeclampsia and premature birth. So we talk about all of those things while also being that support system to mom, whether she's breastfeeding for the first time and it's her fourth baby, or breastfeeding for the first time and she's a teen mom. So we're that layer of support to help guide them to through their journey of motherhood, whatever that looks like for them.
Thank you. And I'd love framing it that, you know, moms can breastfeed whenever they are in their journey of parenthood, right? Even if you didn't breastfeed your first baby, that doesn't mean you can't breastfeed your next baby and get that support. And also too, that we know breast milk is really important for our babies in the NICU and our babies that are low birth rate, have been born too soon. And so just really encourage families to seek the support that they need in the NICU, in the hospital, with their clinicians, outside in the community, to make sure that their babies have access to, you know, really what you put forward, this life-saving nutrition. So thank you for framing that. I want to ask you, Mercedes, we hear a lot about community doulas. Like, what is the difference between a community doula and a traditional doula? And can you tell us a little bit more about the AAIMM doula program?
Okay, where do I start first? So the difference between a community-based doula and traditional doulas, we provide, you know, we are active in the community know who we are, and we want the, you know, the collaboration with the community, the partnership with the community, so we can educate the families we serve. So community-based doulas provide that more one-on-one, like peer support to the families that we serve. And we also, you know, try to get the optimal health for the client. So that's prenatal care, like Nitra stated, breastfeeding, providing more breastfeeding education and getting the numbers higher. The importance, what was the other question? I'm sorry.
Yeah. No, so what's the difference between a community and a traditional doula? And then also tell us about the AAIMM doula program and what makes it unique.
Okay, so the AAIMM doula program, its focus is to decrease the infant and maternal mortality rate. So there's tons of spas in LA County. Again, our focus, Antelope Valley is my focus area. So I provide support, and we provide support for the families in our community. The AAIMM doula program was created with the goal of decreasing the infant maternal mortality rate. So we have seen families with decreased medical interventions, decreased cesarean rates, and just the childbirth education, the parenting skills. The AIMM Doula program can be found on blackinfantsandfamilies.org for more information. We are a team of amazing doulas, and we just provide that support for our communities.
And Marcia Dimes is really a proud partner with AIMM. We're part of the steering committee. And what I've been really just impressed by is the outcomes for the AIMM Doula program, that we see that the AIMM Doula families have better birth outcomes than when we look across the county and those families who aren't receiving these services. So thinking about, lower C-section rates, lower preterm birth rates. And so it just really does highlight how doulas do impact and improve birth outcomes. And one of the great things about the AIMM Doula program is that it's free. So for Black families in LA County who might be interested in having a doula with them, this program is free. Also, too, there's other programs across the county that provide free doula services for Black families, such as Frontline Doula Program, as well as the Sankofa Birth Worker Collective out in the Inland Empire. And so this is really important to highlight, that we don't want families to think that they shouldn't try to access a doula in these services because of cost. And so wanting to just highlight that there are programs out there for families that can provide free doula services to them. I want to turn back to also to Renisha. And if you can tell me, what are some breastfeeding tips that you would give mamas in the audience? If a mama feels like she, is having a hard time or doesn't know where to start or might not be getting the support that she needs, either at home or at work, what are some tips you can give some of our mamas in the audience?
Great question. I would say definitely do your research. Like if you're prenatally considering breastfeeding, definitely do your research, read up on breastfeeding as much as you can, and build your support network, like with family, friends that have breastfed or that support breastfeeding. I would encourage you also to join like prenatal and breastfeeding support groups, because there you have a safe environment where you're able to share and learn from others and have others support you, especially if you have family members that really aren't that supportive of breastfeeding. Definitely informing your doctor and your healthcare team of your desire to breastfeed, so that when the time comes, you have that support and the resources that you need. We have agencies like WIC program, Leche League, and lactation consultants that have LCs usually available for moms that need breastfeeding help or that are having breastfeeding difficulties. And then most importantly, when you run into breastfeeding difficulties, please reach out for help. There are so many women that just suffer in silence. And sometimes by the time I get a mom, I'm like, why didn't you call sooner? Why didn't you reach out to me sooner? So when you are running into problems, reach out for help. You have your local WIC agency, PHFE WIC, or wherever your local WIC agency is, reach out. They usually have lactation consultants available to you. And also remember, if you're currently breastfeeding, just remember in order to make milk, you got to remove milk. So you have to demand it for the body to supply it or produce it. And it's important to protect your milk supply with frequent feedings, latching, pumping. Breastfeeding's like learning a new dance. Mom and baby, they both have to find their rhythm. If you could get over the first 2 weeks, you're good, because the first 2 weeks are the most challenging. So it's important to reach out during that time or when you run into any kind of difficulty. And then positioning, proper deep latch is essential for optimal milk transfer, minimizing pain, sore nipples, and making sure baby's getting what baby needs.
Thank you. And there's a couple things that you said that really resonated with me. One is to let your provider know, your healthcare provider know prenatally that you want to breastfeed, right? So after your baby's been born, it might be a little bit more challenging to get those supports that you need, but you want to set yourself up and your family up for the best possible outcome. So, talking to your provider, and if they don't bring it up to you, then you bring it up to them, right? Like, let them know, like, I intend to breastfeed. What do I need to know? What community resources are there out there if I should need them? And then also to ask for help. I know when I, was breastfeeding, it was hard. I had a hard time. And I remember like feeling a lot of shame because, I just thought like breastfeeding is so natural and normal. Everyone should be able to do it. Why am I having such a hard time? And I remember someone saying to me, like, most mamas have a hard time. Like, this is normal. And so the whole idea of asking for help and knowing that it can be difficult and that's normal and that's okay, but to ask for help. So I really just appreciate you like lifting those up. So for our families to know. When we hear about doulas, Mercedes, a lot of families think like, so if you're helping the mom, the birthing person, you're in the room and I'm a partner, a father, an auntie, a grandmother, like, where do I fit in? By you being there with the mom during, prenatal and birth, like, am I displaced? So tell me a little bit about like how doulas help fathers and partners and families during, prenatally, during the birth and after the birth.
Okay. So doulas, we do not take over or exclude any of the family members. We all are in partnership. We all are a part of the birthing team. And how they can support, just step in and take a role. Don't really ask the mom. I'll say don't ask the mom because the mom will say she don't need any help or she possibly don't need assistance. So just, if the laundry needs to be done, do the laundry. If the baby needs to be fed, see where you can step in and help mom do that. Other family members, they can, either cook a meal or have a meal delivered. So there's a role for everyone. No one is excluded from the team, and it's just a partnership. So we just work all hand in hand with one another.
And what are some things that a partner, dad, a grandmother, auntie can do when you talked about the meals and bringing in the meals and helping. What are some tips that you would give a family member or partner to do to help during labor or birth?
For labor and birth, what they can do, they can step in. So we can do like dancing. I heard Ronitra say dance. But that was talking in regards to breastfeeding. But no, you can dance with the birthing person. You can just, take pictures. You can become the photographer. You can, clear a space for mom to have an area to recover. You can massage mom's feet. Like there's tons of things you can do as a support person. So whether that's the partner, the parent, the aunt, the uncle.
I love that. I love that there's different ways that folks can be a part of. What about during prenatal visits? Are there things that partners can do to help during the prenatal visits as well?
Well, yeah, if they don't understand something, ask the questions. Ask the questions. Don't sit back and just, think the answer is going to come to you. If you don't understand, definitely ask. You can ask the doula, you can ask the hospital, come up with a list of questions for the medical professionals that the doulas can't answer, because we can't give like medical advice, but we can just make suggestions. So if you can come up with a list of options to ask the medical provider, that would be great.
And then to our CinnaMoms partners, what are some things that family members can do to help support mamas during breastfeeding and lactation?
When mommy's breastfeeding, somebody can bring her a glass of water, bring her some snacks. Like Mercedes says, take photos. There is a there's a place for everybody, like Mercedes mentioned. Just help support mom. Ask her what she needs when she's going through that rough patch. Give her words of encouragement. Build her up. Just be there as a support.
Yes, definitely. Echoing what Throny said, be her cheerleader. Moms don't hear enough. You're doing a great job. So, in the hardest time when it comes to overcoming those breastfeeding hurdles, just being her biggest cheerleader and showing that you're there to support her and that you're cheering her on to do this incredible work to raise a child. I mean, that's part of the way of getting her to the finish line of whatever her goal is.
And do you have any suggestions for mamas that are breastfeeding and lactating at work? So if they're, going back to work or going to school, but they're still, breastfeeding or pumping, do you have any tips, words of wisdom for them?
Definitely, I would say communicate with your employer. Talk to your manager, supervisor, HR. Let them know, hey, I'm returning soon. For some employers that I think have 50 or more employees, they are, I think, mandated by the state of California to allow an employee to pump or give them adequate break time to pump and not in a restroom. So communication is key in reaching out before going back, talking to your manager, seeing where there's a space for you to possibly pump, a place to be able to store your milk. And then remember, when you do go back to work, you don't have to have a freezer full of milk. We usually recommend having a 2-3 day supply, maybe start pumping and storing 2 weeks before going back. But most importantly is communicating with your employer about your plans to continue to breastfeed and provide breast milk for your baby, which is going to require that they pump probably 2-3 times while they're working. So they need accommodations to do so.
And then can you talk a little bit, and sort of going back, we had talked about, some of, the disparities in breastfeeding rates among Black families, and Black families having lower breastfeeding rates. Can you give us reasons why that is? And if there's historical context why, you talked a little bit of, about some policies, but can you give us some reasons why we see that?
Well, you mentioned historical context. I mean, back during slavery days, a lot of Black women were considered wet nurses. So, and some women did it as a profession. So I think maybe us coming out of slavery and, becoming more modernized, we've kind of come away from that.
Can you explain what a wet nurse is?
A wet nurse.
I know.
Yeah, so back in slavery, a wet nurse was typically a slave that would breastfeed her master's children. And oftentimes she would have to designate one breast to feed her master's child, and then have to be able to feed her child with the other breast. So that's what a wet nurse was considered. And then it was also a profession for some women too, I guess, after slavery, as a way to basically provide breast milk for moms that couldn't breastfeed or had maybe medical issues or some kind of issue going on with their supply, but they would basically provide breast milk as a way to make a living.
And then do you think, are there things that we can do when we're talking about Black Maternal Health Week, looking at our Black community, what we can do to increase
the rates? I would say advocate for yourself. Advocacy is so important, especially when you're dealing with your healthcare provider. Let them know what your needs are. And if you feel that you're not being heard, then find another doctor, basically, because we have heard with the disparities among African Americans that we're often not listened to when we report problems or have concerns. So, and just the whole, system of inequities and injustices that we have to endure being in this country I also think contributes to our low numbers. Going back to work is really a big one too for a lot of women, because it just kind of, breastfeeding is kind of, what's the word I'm looking for? weaning happens a lot earlier than we would like because women have to go to work. So if we could kind of maybe get some better maternal leave laws on the books to have moms stay at home longer with their baby so they're able to breastfeed longer, that would be great as well. And just having also educating our families as well about breastfeeding, because some families don't know what the benefits are for mom and babies. They don't know why baby's behaving this certain way at this certain age because of growth spurts. So they're just pushing mom to offer formula. So just basically educating your family, your peers, building up your support network, advocating for self. Yeah, I think those are some things that could definitely help kind of turn the tide with our low breastfeeding rates.
And I think, one thing for me that I feel like I've seen is like what you talked about, both like the normalizing of breastfeeding in our community, right? I think especially with social media, there's just so many different groups. We think of campaigns. I think Access is just like beautiful pictures showing, Black mamas and families breastfeeding out in public that I feel like people maybe didn't see previously. And so, I don't know, Caitlin, if you want to talk a little bit about, Breastfeeding Awareness Month in August and Black Breastfeeding Week, and why these weeks are so important, and what are some of the activities that CinnaMoms might do during this week.
Yeah, so it's really important to normalize breastfeeding because it is something that a lot of families don't experience. And sometimes we're the first in our family to breastfeed, and we're that pioneer. Then we're the first for our friends and the first for our nieces. So normalizing the fact that women do breastfeed, Black women do breastfeed, and that it's okay to breastfeed beyond a year. Your baby's not too big to be breastfed. We all know it's important to continue to breastfeed past a year because of all of those benefits that Roni just listed. So showing that it's okay to normalize it and showing that it's important to celebrate it. So what CinnaMoms does to celebrate breastfeeding, we collaborate with other organizations for Black Maternal Health Week. This week, we're collaborating with Black Women for Wellness, doing a Kitchen Divas segment. Myself, Roni, and another one of our CinnaMoms members will be talking about postpartum nutrition and breastfeeding, using healthy foods. Particularly, our WIC cash value benefit increased due to the American Rescue Act. It increased from $11 for a breastfeeding mom to $47. So talking about how you can utilize this increase to buy those nutrient-rich foods like folate and omega-3s to help with postpartum recovery, iron, protein, so that they can continue to breastfeed, protect their supply, and be healthy enough to have another baby if they choose to, without having any pregnancy-related risks, health risks.
And so you talked a little bit about foods that are rich in like folate, omega-3s, that helps with lactation and breastfeeding. Can you give an example of what some of those foods are?
Yes, so folate is really great for mom and baby. It helps with preventing neural tube defects or birth defects. So sources of folate are your leafy green vegetables, so kale, spinach, broccoli. They're even in enriched cereals like oatmeal, your Cheerios. So it's in a lot of different places.
And thanks for lifting that up. And one of the things that March Dimes actually pushed for is putting folate in tortillas, because we know like certain communities, like you might not be eating as much cereal or breast, but you're eating some of your traditional foods like tortillas or other foods. So really making sure that folate is in these foods that all families are accessing to reduce risk of birth defects and also to increase this, maternal health.
Yes.
Thank you for that. Mercedes, as we talked about at the beginning of the program, that we're hearing more and more about doulas and in the media and social media, in terms of legislation around doulas. One thing that has come out in California is SB 65, the California Omnibus Bill, that Marcia Dimes is a proud supporter of. And I know that others, AIMM and others have been, California WIC also too was a proud supporter of SB 65. And one of the components of SB 65 is making doula care a Medicaid benefit. So moms who are on, who have Medicaid can get doula care, and doulas can be reimbursed. And so we hear so much about doulas in popular media, press, social media, and doulas being lifted up, even when we think about nationally, right? With the federal omnibus bill, like really calling out doulas. Why do you think there's so much emphasis on doulas now? And especially as doulas being a component in improving Black maternal health outcomes?
I think doulas are more important now because like we're the navigators, going back to the community base, like the navigators in the community. So again, providing them with the early education, because doctor visits are what, maybe like 15, 20 minutes, so you're in and out, so we're touching on the components of, finding out if they want to breastfeed and providing them information with that. I'm not a dietitian, but, providing them with the, foods that they should eat, or, what's nutritious for the pregnancy. And then just being there to hear them. So I would say like being like the navigator, it's important, it's important.
And then what would you suggest a family think about when they're seeking out a doula? What are some of the characteristics or needs that a family might consider when they're looking for a doula to be with them during this time?
Just making sure that they're like culturally aligned to what they, believe in. If they're supportive, like the education that they have behind their belt, I would say like interview a couple of doulas. Don't just go with your first option, or, who you have or who you're given, interview and see, what they can provide you. Because not every person is the same. One person may need something more than the next client. So definitely ask questions. Going back to the ask questions.
Yeah. And I think also too, one of the things that is so important is, asking the questions. What does support for you and your family look like, right?
Mm-hmm.
The whole idea when you explain about communities, doulas being different than other kinds of doulas, right? But we know like what impacts our health. It's not just us like showing up in the doctor's office and having access to medical care, right? It's, our ability to get to medical care, transportation. It's our ability to access those healthy, like, omega-3 folate rich foods that we talked about for breastfeeding, right? It's having those policies and, a job where we can take time off to go to our prenatal appointments, time off to pump. So much of that, when we hear about like the housing crisis in LA, right? Especially what happened during COVID, where, families being really impacted in terms of their jobs, and seeing that like Black and Latino families were really impacted by COVID, more than other families in California and in LA County. So we know that it's just not showing up to the doctor. And so I, like how you talk about doulas and community doulas really being that bridge to the community, being in those resources. Because we know all those things will, our ability to access healthy foods, our ability to reduce our stress, to have respectful care, to get to our doctor will have better outcomes for us. How can someone, a mama with families who's interested in an AIMM doula, find out more about AIMM, find out about the AIMM Doula program?
Yeah, so they can visit blackinfantsandfamilies.org. The point of contact will be Ariana White. Her information is on the website, blackinfantsandfamilies.org.
And then what about, we mentioned the CinnaMoms website. Is CinnaMoms, are the groups in just one facility? Are they in different, because we know LA is big, are they in different parts of LA? Like where are the different communities that the CinnaMoms support groups and services are located?
So our CinnaMoms services are virtual. So we meet bi-monthly on Zoom the first and third Thursday of every month. Our next meeting is on April 21st at 10:30. So to RSVP, they can visit our website, www.cinnamoms.org. We also share our flyers on social media. So if you have Instagram or Twitter, it's CinnaMoms_, and we'll share the information there as well.
And then Mercedes, do you have a social media handle that you would like to share as well?
No, not at the moment.
Okay.
Thank you.
Also want to sort of bring it back to you, Mercedes. What do you think what is like healthy and joyous Black birth for you? Like when you see sort of a vision of healthy and joyous Black birth, what is that? And what do you think families need to be able to attain that?
For me, I feel that families need to have the support to advocate for themselves, asking questions. I like to ask a lot of questions. So yeah, asking questions. A healthy and joyous birth would look like, non-traumatic, having your ideal birth met. I like to get my clients to think about their ideal birth, preferably before it's time to actually give birth. So we talk about, if you can have the perfect birth, what does that look like? What does that smell like? Envision it now. So by the time you get there, it won't be like a lot of stress. And we work through those stressors and talk it out. And if I can give like any advice, if you feel something, say something when you're in the birthing space, because you know your body better than anybody know your body. So although you may tell me something, I don't know your body like you do. So just speaking up in that advocacy.
I love the idea of speaking up if you feel something, if something's not right, speaking up for that. It's so important. One resource that Marcia Dimes has is our COVID-19 birth plan, because we know that during COVID and now even that your prenatal care, labor and birth, and postpartum care is different. Even if we see restrictions lifting in other parts of our life, there's certain restrictions still in place for hospitals and clinics that might be different than we see, going to the grocery store. And so what the birth plan does is really does help navigate questions and conversations and discussions that a birthing person can have with their provider during prenatal care, for labor and postpartum care, breastfeeding. It's a resource that families can work with their doulas around, their CinnaMom support, bring into their own prenatal appointments, but really being able to have those discussions ahead of time. And so that their needs and their desires are known. And also too, there is a resource. The CDC has a Hear Her campaign about maternal warning signs, and it's both for, there's information on it in cdc.org/hearher, HEAR, Hear Her. And there's resources on there for both providers, pregnant people, and their family members. And we hear so often for Black women showing up, calling the OB, going in the emergency room, knowing something is not right and not being listened to. And one of the resources that the website has is a script. How do we tell our providers, I've been having this headache for 2 days. It happens at night, I'll eat, I'll lay down, it still won't go away. What are the things that we're telling the providers? And to make sure that, we are being as descriptive, as distinct as possible, so people know what our concerns are, but also to really speak up, like as you said, if something is not right. And for our CinnaMoms, for Manisha and Kaylin, what does healthy, joyous Black birth look for you? Healthy, joyous lactation and successful lactation look like for you?
During one of our support groups, I forget the young lady's name, but she shared her birth experience. She was able to, through some type of grant, secure funding to have a midwife. And she described her birth, and it was so beautiful how she was in a tub with warm water. Her partner was there. Her favorite song was playing. Just whatever she wanted, she was able to have in terms of her environment, her setup. So a joyous Black birth to me is, and I know things happen and birth plans may change, but if at all possible, if a mom can, have the option of choosing a midwife versus having a traditional hospital birth, having her partner there, her favorite song, her loved ones there as well to help support her. To me, that's a joyous way to bring a child into the world.
Kaylin, what about for you?
Yeah, for me, a joyous Black birth is just mom being able to know all of her options so that she has a choice to do what she wants to do, whether it's having a midwife or a doula or having that C-section scheduled on this day at this time because that's what she wants. It just needs to be an educated decision that she is aware of all of her options so that she can be empowered in what she decides to do. So that to me is what makes any birth joyous and celebratory.
I love that. I love the whole emphasis on options, right? We know that there are moms out there who, have high-risk pregnancies, who might have preeclampsia, as you mentioned before, who know that they might have to have a scheduled C-section because of, a condition or a previous birth. But that doesn't mean that the experience can't be beautiful, that it can't, hold space for our families. As Mercedes had mentioned before, we often hear that it's not just, the birth outcomes, right? Like, was there, no C-section or was it a full-term baby? That's not only important. What's also important too is moms, how they felt afterwards, right? And so you can have that scheduled C-section, but still feel empowered, still feel listened to, still feel respected. So I really do, I really appreciate you just lifting up that for all of you, like what that looks like, right? How we can really envision what a healthy and joyous Black birth look like for our families. I encourage the audience, we're gonna open it up for questions and answers. If you have any questions, please drop them in the chat and let us know, and because we would be happy to answer them. I wanted to say, Mercedes, if you if there's a mama out there or you have a client who might face barriers with the clinician, the not wanting the doula there, or the doula not being able to go into the hospital, are there things families can do to just, speak to the provider around knowing the importance of what doula care brings? And if for some reason hospitals aren't allowing doulas in the hospital, how doulas can still support families?
Yes, so majority of hospitals, since we have the COVID restriction lifted, majority of the hospitals are allowing doulas inside of the birthing spaces. But if you aren't allowed a doula, we can still provide, virtual support. So on a video platform, Zoom, what else we have, like Skype, different things like that. You still can get doula support.
And if you have a mom out there who, is talking to the provider and telling the provider, oh, I think I want a doula, and the provider isn't so sure about doulas or doesn't know what a doula is, what are like 2 or 3 things a family can tell their prenatal care provider about the benefits of a doula and why a doula is important?
They can tell the provider that the doula has been my navigator. The doula is my support companion. My doula is culturally competent, so I relate to my doula in different ways, and specify those ways. And then just, my doula is Black, African American.
And it's important to have someone in the room and supporting you who knows you and your family, your background, to be in that space with you.
Yes, for sure.
And then what are some things, for Renitra and Helene, what are some things that a mama could tell her provider too, if the provider is not encouraging breastfeeding or not supporting them around their breastfeeding goals, that they can, 2 or 3 things they can tell their provider why breastfeeding is important and how they would like to be supported around their breastfeeding goals?
I would say find another provider. Most providers they do encourage breastfeeding, but if you have one that is just not all that supportive of breastfeeding, I would definitely try to find another provider. But also looking for support groups as well, like CinnaMoms, looking to getting a doula possibly, just trying to build your village of support to kind of get help with breastfeeding is what I'm trying.
What about you, Caitlin? What would you?
Yeah, I agree with Roni. Get a second opinion, build your village of support if you're able to. Sometimes we're not able to change our doctor, but if you're able to build around your support to find other people that are also giving you evidence-based knowledge and giving you the right suggestions and telling you, well, this is what's suggested by the American Academy of Pediatrics or World Health Organization or whoever, then give them a listen to.
Okay, thank you. One thing that I just really want to encourage the audience to, find out more about these organizations, looking at, the AAIMM Doula program, as well as the AAIMM initiative at Black Families, BlackInfantsAndFamilies.org. Also checking out the Sankofa birth workers, as well as the frontline doulas, and the frontline doulas actually have a hotline. So if you have questions and you're not sure if you want a doula or need a doula, their frontline doula hotline is a great resource. Also encourage our audience to reach out to CinnaMoms at CinnaMoms.org to learn more about their resources, to learn more about their programs. And also, we know with SB 65, as we talked about before, this benefit that's part of the bill is a benefit to provide doula care as a benefit for families that are on Medicaid. And we want to make sure that all families have access to this, especially the families that are most in need of having a doula. Those who have greater risk for poor outcomes are able to access a doula. And so if you have any questions about the implementation of this benefit, which is supposed to go into effect next year, January 1st, if you have any information, if you have any questions, if you would like more information about the benefit and how it's moving along in terms of legislation, we encourage you to go to the March of Dimes website and our action center, so marchofdimes.org. Also, too, you can reach out to AIMM program, Black Infants and Families, as well as CinnaMoms, to just learn more about this legislation. I just want to thank everyone for joining us today. This has just been an amazing conversation. I've learned a lot, so I hope the audience has learned a lot as well. I want to thank you, Mercedes, for just your time and your wisdom, sharing just your own experience, not only as a doula, but also too as an AIMM doula, and the differences between what a community doula brings, because I think it's just so rich that folks don't always know. And then Renitra and Kaylin, just really appreciate you all being here and sharing what the support and resources around breastfeeding, how it's important, what are the resources out there, and just giving us these tangible, concrete tips that our families can use. And so also too, just want to remind the audience that we have another program with LA Public Library on Wednesday from 12 to 1. It's a virtual yoga class, a Mama and Me yoga class. So it's simple stretches that you can do by yourself or with your family. But it's another way for us to just center Black families and our needs for care and support. So thank you so much, and turn it back over to the LA Public Library.
Thank you so much, you guys. It was a wonderful presentation. I wanted to remind everyone that this program will be on YouTube. So it'll be on there indefinitely. So probably starting tomorrow, if you go to lapl.org and just go to our YouTube page, it'll be on there. So if anyone missed anything, you can watch it again. And then also, yes, as Mashariki mentioned, we do have more programs coming up this week. It's Wednesdays, our virtual yoga session. And to find out more about all of our programs for Black Maternal Health Week, everyone can go to the Maternal and Health Week webpage. So it's www.lapl.org/maternal family health. And there's more information on there. And thank you guys again for a great presentation. And the resources are here. And I hope everyone has a great rest of their afternoon. And that's it. Thank you guys again.
Thanks so much.
Thank you.